was billed as a last-ditch effort to save health care legislation. President Obama summoned congressional leaders to a meeting meant to build consensus on a health care reform bill. Both sides seem to agree the system is in need of repair. But after 6 hours of talks, it's clear Republicans and Democrats are not close to any agreement. Now, Democrats are threatening to push the bill through using the power of majority.
Is there enough serious effort that in a month's time or a few weeks' time or 6 weeks' time, we could actually resolve something? And if we can't, then I think we've got to go ahead and make some decisions, and then that's what elections are for.
The whole concept of the bill, with its government mandates, its taxes, its spending, and all of the other features of it, are what make it unacceptable to us.
So will Democrats go it alone? For more on the health care summit and the next step lawmakers will take, we're joined by David Mark, senior editor for Politico. Good morning.
Hey, good morning. Good to be with you.
Good to have you here. The big question, was there a true hope that the summit could advance the health care debate, or was this all for show?
I don't think it really changed any minds of anybody in the room or anybody else in Congress, but I do think it was educational for the public. The general public, the American people really got to see the differences, the divergences in policies between the Democrats and Republicans, and I think that will inform the debate going forward.
The Republicans for a while now have been criticized as being the party of no, that they're united in opposition. Do you think that that's a fair assessment when it comes to the health care debate?
Republicans would say that they do have their own proposals. It's more along the lines of private sector initiatives. It would allow people to maybe buy insurance across state lines, get more of a role for private insurance companies. But it is a fair question to ask that Republicans had control of Congress for about a dozen years or so, and they didn't make any major moves on this. So I think Republicans would be better off just coming out and saying, hey, we have a different view. We don't think it's necessarily the government's role to be so involved in health care.
As you mentioned, we got a chance to hear those two different views today, and there were a lot of facts and figures being thrown around. How accurate were they when you look at the total picture?
It's an old political trick to pull out kind of all sorts of facts and figures and use them to your own advantage. We heard President Obama talking about the 30 million uninsured people, which may be technically true, but some of those are part-time workers. There are some contingencies. Republicans brought up their own facts and figures that were really debatable at best. So I think people have to kind of look past that and reach their own conclusions.
Senator McCain and President Obama had an interesting exchange. What did you make of that?
It was really feisty, the kind of back and forth between the erstwhile former presidential rivals, President Obama and now still Senator McCain. It was really interesting to see President Obama almost lose his cool. He's usually so calm and collected and measured, but when Senator McCain started speaking and taking issue with the president's health care plans, we saw Obama really kind of get flustered and even angry. We don't see that in public a whole lot.
President Obama at the end of the summit said that he intends to push this through without Republican support, and there's a term reconciliation that we hear a lot about. Explain to us, what is it? How does it work?
It's essentially a procedural move that aims to get around a Senate filibuster, which requires 60 votes. Under reconciliation, you only need a bare majority, 51 votes. The Democrats in Congress have been signaling this for a couple of weeks now, and I think that was the whole point of the summit on Thursday, for the Democrats at least to be able to say, we went through the motions. President Obama can say, we tried everything we conceivably could. The Republicans wouldn't play ball. Now we're going to use whatever tools we have at our disposal and get this thing passed.
And just to clarify also, reconciliation is not something new. It's been used in previous administrations as well, right?
Absolutely. It's been used about 21 times over the last 30 years or so, meaning it's not real common, but it's certainly not unprecedented either. The Bush tax cuts in 2001 and 2003 were passed that way. Welfare reform back in 1996. So it does happen. It is just somewhat out of the ordinary.
All right. David Mark from Politico. David, as always, thanks for being with us.
Thank you.